Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating study concerning the long-term effects of dietary salt in aged cats. The central question revolves around the safety of high-salt diets, particularly their impact on renal and cardiac health in older cats. High-salt diets have been shown to increase water consumption, which results in urine dilution and, consequently, a decreased risk of urolithiasis, or the formation of urinary stones. Many commercial veterinary diets formulated for urolithiasis management incorporate this increased sodium content. However, the question of long-term safety looms large. In humans, high salt intake is linked to increased blood pressure, systemic arterial hypertension, and chronic kidney disease, raising concerns about similar effects in cats. While prior studies have suggested that high-salt diets do not adversely affect cardiovascular or renal health in cats, there is a need for more extended research, especially focusing on healthy aged cats, given the age-related increase in blood pressure and decline in renal function. To address these concerns, a team of researchers embarked on a 5-year prospective, randomized, blinded, and controlled study known as the Peanut Study. This study aimed to evaluate the renal and cardiovascular safety of a high-salt diet when fed to healthy aged cats over a prolonged period. Let's explore the methodology employed by these researchers. 26 aged, neutered domestic shorthair research colony cats were screened for eligibility. To qualify, cats needed to display cooperative behavior and have normal results from ultrasonography, standard echocardiography, and conventional cardiac Doppler examination. The selected cats were housed in a carefully controlled indoor research facility with a 12-hour light/dark cycle, controlled temperature, and ventilation. Before the study, the cats were fed a maintenance dry expanded diet with a sodium content of 2.3 grams per mcal. Throughout the study, all cats had free access to water. The study was designed as a prospective, randomized, blinded, and controlled trial, lasting up to 60 months. Approval was obtained from the Animal Care and Use Committee of Pays de la Loire and by Royal Canon's Ethics Committee. The study adhered to the conditions approved by the French Ministry of Agriculture, as well as the guidelines in the Guide for Care and Use of Laboratory Animals. Eligible cats were divided into 3 subsets based on 2-dimensional color tissue Doppler imaging findings at baseline: normal, subnormal, and abnormal. Subnormality was defined as the presence of regional post-systolic contraction waves for the left ventricular free wall, the interventricular septum, or both, in the absence of any other alteration. Abnormality was defined as mild to moderate regional diastolic alterations as indicated by an early to late diastolic velocity ratio of less than 1.2. Within each subset, cats were ranked and paired based on glomerular filtration rate, and then randomized to either a control diet or a high-salt diet by a coin flip. The high-salt diet contained 3.26 plus or minus 0.30 grams per mcal metabolizable energy of sodium, equivalent to 1.3% as fed, and 5.71 plus or minus 0.28 grams per mcal of chloride, equivalent to 2.27% as fed. The control diet contained 1.02 plus or minus 0.16 grams per mcal ME, 0.35% of sodium, and 2.26 plus or minus 0.33 grams per mcal ME, 0.7% of chloride. The cats had individual access to 70 grams per day of their assigned diet via programmed collars, corresponding to the energy requirements of a 4.8 kilogram cat in good body condition. Now, let's look into the various assessments performed throughout the study. At baseline, and then every 12 months for up to 60 months, a comprehensive set of evaluations were conducted. These included body weight, measured weekly food consumption, measured daily hematology, blood biochemistry, and hormone assays. Blood samples were collected via jugular venipuncture and cephalic vein microsampling. Plasma biochemistry was analyzed for a variety of substances, including but not limited to albumin, bilirubin, glucose, cholesterol, triglycerides, sodium, potassium, chloride, total carbon dioxide, calcium, phosphate, total protein, urea and creatinine concentrations, and alanine aminotransferase and alkaline phosphatase activities. Serum total thyroxine concentration was also measured. Urinalysis. Urine samples were collected via cystocentesis and analyzed for urine-specific gravity and urine protein/creatinine ratio. Glomerular filtration rate. Glomerular filtration rate was determined using plasma clearance of exogenous creatinine. Blood pressure. Systolic arterial blood pressure was measured indirectly in awake cats using a Doppler system. Systemic arterial hypertension was defined as an average systolic arterial blood pressure of greater than 160 millimeters of mercury. Renal ultrasonography. A veterinary echographer measured the ultrasonographic appearance, length, width, and height of both kidneys, as well as resistive indices of renal and interlobar arteries. Standard echocardiography and conventional Doppler examination. An experienced board-certified cardiologist performed standard transthoracic echocardiography and conventional Doppler examinations in awake standing cats with continuous electrocardiogram monitoring. Two-dimensional color tissue Doppler imaging. Examinations using two-dimensional color tissue Doppler imaging were performed by an operator blinded to the diet assignment. Necropsy examinations. Necropsy examinations, including histopathology, were conducted on cats that died naturally or were euthanized during the study due to severe disease. Retrospective case review of renal function. Following the conclusion of the study, a veterinary nephrologist evaluated serial results of plasma creatinine and urea concentrations, spot urine specific gravity, and body weight to identify cats with evidence of deteriorating renal function. Now, let's analyze the results of the study. 20 healthy neutered cats, 5 male and 5 female, were enrolled and randomized to each diet group. The groups were found to be similar at baseline for all study variables. The median age and body weight for the control group was 11.0 years and 5.06 kilograms, respectively, while for the test group, these values were 11.6 years and 4.51 kilograms, respectively. Baseline two-dimensional color tissue Doppler imaging was normal for 8 cats, subnormal for 6 cats, and abnormal for 6 cats. The baseline glomerular filtration rate was 1.9 milliliters per minute per kilogram in the control group and 1.9 milliliters per minute per kilogram in the test group. Study survival and discontinuations were also analyzed. No significant difference was observed between the diet groups with respect to the probability of remaining in the study. The median time in the study was 38.7 months for the control group and 51.4 months for the test group. Statistical analyses excluded data obtained at month 60 due to the fact that only 4 cats remained in the study at that time. Necropsy examinations were conducted on cats that were either euthanized during the study due to severe disease, died naturally, completed the 60-month study and were later euthanized, or were excluded during the study. No cats were euthanized for, nor died from, cardiovascular disease or chronic kidney disease during the study. 2 cats were removed from the study due to a cardiovascular or renal disorder. 1 control cat with persistent systemic arterial hypertension, and 1 cat in the test group with azotemia. The case review identified deteriorating renal function, indicative of early chronic kidney disease, in 4 non-azotemic cats, 2 in each diet group, which was supported by necropsy findings of chronic kidney disease. 1 cat in the test group had no biochemical evidence of renal deterioration during the study, but was euthanized 3.5 years after the study ended with chronic kidney disease complicated by pneumonia. Hematologic variables were mainly within reference intervals. Biochemistry variables were also mainly within reference intervals. Serum total thyroxine concentrations remained within the laboratory reference interval, except for 1 cat in the test group that was diagnosed with hyperthyroidism and left the study after month 36. In terms of indicators of renal function, glomerular filtration rates tended to decrease over time, but no significant difference was observed in the rate of decrease between the groups. Plasma creatinine concentration decreased over time in the test group. However, there was no significant difference compared to the control group. Urine-specific gravity values decreasing to less than 1.030 were evident in cats diagnosed with chronic kidney disease, or those considered to have early chronic kidney disease in the case review. With respect to blood pressure, no significant change in systolic arterial blood pressure over time was observed in or between the groups. In the test group, 3 cats had at least 1 systolic arterial blood pressure measurement greater than 160 millimeters of mercury. No significant difference was found between the diet groups with respect to the frequency of hypertension. Cardiac and renal imaging results showed that all 2-dimensional and M-mode echocardiographic variables remained within reference intervals throughout the study for all cats. The end-diastolic left ventricular free wall thickness tended to decrease over time. However, the rate was not significant in or between the groups. Food consumption decreased significantly over time in both groups. However, the rate of change was not significantly different between the groups. Body weight also decreased significantly in both diet groups. However, the rate of change was not significantly different between the groups. Now, let's summarize the key discussion points from this study. The study aimed to assess the safety of a high-sodium diet in apparently healthy aged cats based on standard veterinary assessments. Chronic kidney disease and hypertension were of particular interest due to their prevalence in aging cats and their association with high salt intake in other species. The study's findings support the long-term safety of a high-salt diet, specifically one with a sodium content of 3.26 grams per Mcal ME, in healthy cats that are at risk of renal and cardiovascular morbidities. This conclusion is based on robust indicators of cardiac and renal function. The survival time in the study was not significantly different between the diet groups, and the causes of discontinuations were consistent with diseases associated with older cats, including chronic kidney disease, lymphoma, diabetes mellitus, and hyperthyroidism. The researchers observed that glomerular filtration rate, the most sensitive measure of renal function, identified two groups of cats. One group consisted of cats diagnosed with chronic kidney disease on necropsy examination, or those showing decreasing glomerular filtration rate in the case review, while the remaining cats maintained a glomerular filtration rate within the reference range. The high-salt diet was shown to have no effect on glomerular filtration rate over time, which is consistent with other studies conducted in healthy older cats. Over the course of the 5-year study, only one cat developed azotemia, a rate that approximates to the estimated 2-year prevalence of chronic kidney disease in cats aged between 13, 5, and 18 years in a United Kingdom primary care practice study. The case review detected early chronic kidney disease in 4 non-azotemic cats. There was no indication in any blood or urinary variables of consistent changes or adverse renal effects resulting from the high-salt diet. The high-salt diet also did not affect kidney perfusion relative to the control diet, as determined by the resistive index for intrarenal blood flow. Systolic blood pressure was not affected by the high-salt diet, and there was no indication of primary hypertensive disease in the test group. The absence of clinically relevant long-term cardiovascular effects of a high-salt diet in healthy aged cats provides further evidence of species differences in physiological responses to high sodium intake. Unlike in humans, the high-salt diet in this study did not induce diffuse or localized hypertrophic changes, left atrial or left ventricular dilatation, systolic dysfunction, or left ventricular outflow tract obstruction. Decreases in interventricular septum thickness at end diastole were observed over time in both groups and may have been related to decreasing body weight. No arrhythmias were detected in the study. Two-dimensional color tissue Doppler imaging revealed no apparent differences over time between diet groups in any variables of myocardial function. Some changes were observed in the E, a ratio measured in the subepicardial segment for the radial left ventricular free wall motion, as well as the longitudinal interventricular septum S-wave, suggesting focal myocardial dysfunction, likely related to focal myocardial remodeling, without any impact on cardiac function. The study also indirectly assessed the impact of dietary phosphorus on renal health. The cats in the study had been fed diets containing 1 gram per Mcal ME of phosphorus in the form of potassium monophosphate and pyrophosphate. The low frequency of azotemia observed during the study suggests that 1 gram per Mcal of dietary phosphorus, at least in the form of potassium monophosphate and pyrophosphate, is safe for chronic feeding. Body weight was found to be stable in both diet groups for the first 2 years of the study, after which it began to decrease. Some loss of body weight was expected with aging and would have been augmented as cats developed diseases associated with weight loss and subsequently left the study. The strengths of this study include its long duration and randomized, controlled, and blinded design. The diet groups were matched at randomization according to both cardiac and renal function, which was important because morbidity in one will affect function of the other. The risk of variability in imaging procedures was mitigated by utilizing the same experienced operators throughout the study. One limitation of the study was the small numbers of cats involved, particularly at the later time points. However, this concern was mitigated in part by analyzing rates of change in key safety variables. Additionally, the researchers calculated effect sizes for diet within time differences to estimate whether small sample sizes potentially were biasing statistical interpretation. In conclusion, chronic dietary sodium intake of 3.26 grams per Mcal ME, approximately 3-fold higher than a standard diet, was found to be safe with respect to renal and cardiac function, blood pressure, and other health outcomes in healthy aging cats. In addition, a diet containing 1 gram of phosphorus per Mcal appeared to be safe in aged cats. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.